I'm the CEO of an organization called Swecare Foundation. We are under, you could say, the Ministry of Health and Social Affairs in Sweden. I thought Sweden, Morocco were probably very different countries. But from our discussions today, I've understood that there are really similarities. We face more or less the same challenges, actually. And I think that's a really interesting thing to start with. I mean, there's a potential. Today I have realized that it's very impressive, I think, the work that I guess the government and the whole nation is carrying out. And I understand that they have an aim to increase accessibility of healthcare for the whole population. That is something that is very close to our hearts as well. The discussions we had today, I'd say, are very honest, very I think we really found a genuine interest in each other's healthcare systems. And when the director at the Ministry of Health told us about the plans and the challenges, we could say that we have really similarities here. We were discussing how our systems actually are constructed in the same way. So I believe, and I think that my organization can help by connecting not only companies but also contacts between Swedish public agencies, the Swedish university hospitals. I think they would have a great interest in meeting with counterparts like CHU that we have met with today, for example. I also know that we have brought also in this delegation representatives of the Swedish bank and economically support system, that we could help sometimes with the financing, to finding the right ways and giving export credit so it becomes a bit cheaper for the buying country. But if you look at the Swedish companies, I think what we have a tradition where we have always had a very close collaboration between the healthcare and the entrepreneurs and also the research community. And that, I think, has made Sweden really innovative country, a really innovative country. For us, I think the first thing we will do is definitely to sit down, I mean the embassy, ourselves, with our companies, and discuss what will be the next step with Morocco, because I think just being here makes you realize much more. I mean, you can hear when you're in Sweden, we talk, oh, it's good, you should go to Morocco, all that, but you don't realize until you really come here and when you meet with people and you have these discussions. So I think that is the first step. But of course, to understand that the potential is so much more than only Morocco, that is something extra, and that is of course something that we should take into consideration. I think, you know, with healthcare, the needs are a bit different, of course, where in different countries, but we all share a challenge that we want to be able to provide good healthcare for our citizens. And in some countries, as you said, then Morocco, you need to build that up, and that will cost some money. In many countries in the Western world, Sweden for example, we have a well-functioning healthcare system, but costs are increasing, the population is aging, all that. So to be able to maintain this system and to continue to provide good healthcare for its citizens, we need to find ways to maybe digitalize, make it more efficient, and all that. So in a way, it's the same challenge. How can we provide good healthcare for our citizens in the future?